Hi, my name is Jessica Brinkman. I am a Doctor of Physical Therapy student at the University of Kentucky, and this presentation is going to be over goal setting and graded exposure. So goal setting can seem very overwhelming to a person with chronic pain, and one of the reasons that is because of the fear avoidance model. So pain is a perceived threat. With chronic pain, the brain may begin to associate certain activities with pain. So then a person may avoid the activity altogether out of fear of causing pain. That leads to activities being avoided in anticipation of pain rather than in response to pain. This is a very vicious cycle because decreased movement is harmful to pretty much every system in your body, your musculoskeletal system, your cardiovascular system, and even your mental health. And because of this, a person becomes even less likely to want to perform those activities. This is why goal setting is so important. It's been shown in multiple studies to positively influence behavior change, and admitting that change is necessary is a crucial first step. However, not all goals are created equal. So how can you set a goal that will help promote change? This is where the concept of SMART goals comes in. SMART stands for specific, measurable, attainable, relevant or realistic, and timely. So let's look at an example. Here's a goal. I want to exercise more often. That's a good goal to have, but it's not a SMART goal. Compared to this, in 6 months, I will have incorporated 10 minutes of walking into my daily routine every morning before breakfast. So let's break that down with the SMART principles. It's specific. It says exactly how and when you are going to do the activity. It's measurable. It gives the length of time, 10 minutes. And it's timely. It gives the end time frame of when the goal is supposed to be achieved. So I skipped relevant and attainable because those are different for every person. There are many factors, including income level, culture, personal interests, pain level, and mental health that all play a role in what makes a goal individualized for a certain person. And physical therapists can help set appropriate goals for their patients. So going back to our example, let's now talk, is it attainable? Is it reasonable? And the answer is it could be, but it may not be realistic for someone who does not have sidewalks near their home or who is not a morning person. It also may not be relevant if the main goal in the end is to stand and cook a meal, because an extended period of time may not directly correlate to the ability to stand for an extended period of time. So 6 months, it could be a great time frame, or it could be too far away or even too soon to attain the goal of 10 minutes of walking, depending on the current activity level and pain status. So 6 months is the time frame. That's definitely a long-term goal. That's pretty far away, but it does not map out the steps needed to get there. So setting a goal that lofty without a plan can be pretty overwhelming. So how can you turn this timely goal into a more attainable goal? You can use the process of graded exposure, which is the process of gradually exposing oneself to a fearful event to decrease the fear avoidance response. So first, you're going to want to identify what causes pain, or in our case, the fear of pain. Then you'll determine which of those activities provoke the least and the worst fear avoidance response, and then slowly start incorporating movement back into life, starting with those lowest ranking activities. This has been shown as a very beneficial treatment approach for those with chronic pain, and it's important to remember moving forward with the process of graded exposure that there is no goal that is too small. So back to our example, let's work on breaking it down into steps using graded exposure. The first question you're going to want to ask is, what is the lowest level of activity that is tolerable? If it's 1 minute, we'll start with 1 minute of walking for 3 to 5 days. If that did not cause a flare-up, you'll try and progress to 2 minutes for the next 3 to 5 days. However, if you found that 2 minutes caused a flare-up or an increase in pain, that's totally fine. You'll go back to 1 minute for another 3 to 5 days, and next time try increasing by 30 seconds, which I know doesn't seem like much, but again, no goal is too small. So here are just some additional tips and steps to success in trying to achieve some goals. You want to make sure that your goal is personally meaningful. So find the why behind your goal. In our case of walking for 10 minutes, maybe it's because you want to be able to walk your child to school, or you want to be able to walk in the park. You want to focus on function, not pain. So you want to think, was I able to wash the dishes today, instead of, did washing the dishes hurt me today? That subtle shift in mindset to more of a positive outlook can go a long way. You want to have open discussions about your journey, whether it's with your physical therapist or friends and family, and celebrate your victories and problem solve your setbacks. It's important to remember that the patient, not the provider, is in charge of their health. So improved self-efficacy or self-confidence can improve results in goal setting. So one last thing I want to mention, it's very important. Bad days are normal and do not mean failure. So in the process of trying to go from a state where you do not move very often to where you're going back to more of a normal function of moving more frequently, it's very common, as you can see, for pain levels to fluctuate to good days and bad days. But the overall trend is that pain decreases as function increases. So just because you wake up feeling worse one morning than you have the last few days does not mean you're back to square one. Bad days do not mean failure. Physical therapy can help in this process. They are trained in goal setting and can help you achieve your goals. So talk to your physical therapist and let them help you design the best treatment approach to achieve your goals. And then here are the references. So thank you very much.